Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons from real cases we see every day. Behind every symptom is a real story, and today's topic highlights something subtle but potentially life changing: that sudden difficulty speaking, words becoming unclear, a sentence that suddenly stops making sense, a brief moment of confusion that disappears almost as quickly as it came. Maybe I'm just tired. I probably just need some rest. Many people immediately think maybe it's stress. Maybe I didn't sleep well. And because the symptoms improve quickly, the moment is dismissed. But sometimes what looks temporary is actually a warning that the brain is briefly losing blood supply, a warning that something more serious may be developing underneath. In clinical practice, it often begins quietly. Someone suddenly struggles to speak. Another cannot find the right words. Someone develops weakness on one side for a few minutes. Then suddenly, everything improves. And that is why many people ignore it. There's a simple way to remember these signs. We call it FAST. F stands for face. Does one side of the face droop when they smile? A stands for arms. Does one arm drift downward when they try to lift both? S stands for speech. Is their speech slurred or strange? But medically, this is often a transient ischemic attack, a TIA, sometimes called a mini stroke. A TIA happens when blood flow to part of the brain is temporarily blocked. The symptoms improve, but the underlying problem may still remain. And that is the danger. Because a TIA is not the main event, it is the warning before the main event. A TIA is often called a warning stroke because it frequently precedes a major stroke. Studies show that nearly 1 in 5 people who experience a TIA will have a full stroke within 90 days. High blood pressure, diabetes, high cholesterol, smoking, inactivity. Over time, these damage blood vessels silently. Warning signs may include slurred speech, difficulty finding words, facial drooping, weakness on one side, sudden confusion, loss of balance. These are not random symptoms, they are neurological signals. It can be frightening to feel your body suddenly lose control, but knowing the signs and acting fast gives you the best chance for a full recovery. Many people wait, they rest, they delay, they say, I feel fine now. But the risk of a major stroke increases in the hours and days that follow. When you arrive at the hospital, every second counts. Doctors will use scans and tests to see exactly what happened in the brain. Prevention is possible. Control blood pressure. Take medications consistently. Eat better. Stay active. Because protecting the brain starts with protecting the blood vessels. Managing stress through mindfulness and rest is also vital for vascular health. Regular checkups with your doctor help catch these issues before they become emergencies. A sudden change in speech should never be ignored, even if it lasts only minutes. Because the danger is not just the symptom, it is what the symptom represents: a brain at risk. And when it comes to the brain, time is not just important, time is tissue. For more information, contact the Preventive Health Institute. Call or WhatsApp us at plus 233 2800 and 720347.